Fox 10 News continuing to follow the COVID-19 outbreaks, and nursing homes remain ground zero for those outbreaks. State health leaders say about 17% of all cases in the state associated with long-term care facilities or nursing homes. Our investigative reporter, Brendan Kirby, now joining us live to talk about why this is happening. Brendan.
Well, Byron, it's not like this has caught anyone by surprise. Nursing home administrators knew their residents were vulnerable, but they've had difficulty containing outbreaks anyway. Take a look at this timeline. The first infection at a nursing home occurred on March 19th in Jefferson County when one employee and one resident tested positive. By April 6th, 30 facilities were infected. That number jumped to 46 on April 13th and 80 by the 27th. And as of today, according to the Alabama Nursing Home Association, 93 of 231 nursing homes have had COVID-19 cases. That's about 40%. The group's legislative director, Christy DeGraffenreid, told a webcast organized by State House Democrats that the problem has been, quote, insidious and pervasive. She said Alabama might not hit its peak for another 2 or 3 weeks.
I think it's important to remember that as our economies try to reopen all over the country, just because we're doing that does not mean that we're going to see a downward trend in nursing homes. As a matter of fact, we're seeing the opposite of that in some places. From the beginning, our healthcare workers and staff have been combating the virus, and our homes have been ground zero, as all of you know. And we have taken many steps to protect our residents and workers.
Residents mostly have contracted the disease from employees who picked it up in the community. Association President and CEO Brandon Farmer says nursing homes have conducted temperature checks and taken other steps to prevent infected employees from exposing residents. But in almost every infection, he added, the infected person had not been symptomatic, and there simply hasn't been the testing capacity to check every single employee every day. Farmer also acknowledges challenges in acquiring masks, gloves, and other personal protective equipment. He estimated it takes 22 sets of PPE to isolate a single resident for 24 hours. And I asked Farmer if he believes the public should be alerted anytime any specific facility tests positive for COVID-19. He responded by saying that all nursing homes follow state and federal regulations. Fox 10 News has been battling the state of Alabama for greater transparency on this issue and will continue to do so. Reporting live for Fox 10 News in Mobile, this is Brendan Kirby.